Hello students, this video will be helpful for you to gain insights regarding water birth. Objectives of this video, we are going to learn the introduction of the water birth, definition, methods, theory behind water birth, history of water birth, stages of labor in water birth, positions of water birth, benefits of water birth, risks of water birth, contraindications and role of midwife in water birth. So introduction, what is birth actually? It is a process or act of giving birth to a baby by a mother. Water birth is a process in which during labor a person gets into a tub or pool of warm water during the first stage of labor before the baby is born. In a water birth, a person remains inside the water during the pushing phase and actual birth of the baby. Then the baby is brought to the surface of the water after the baby is born. A water birth may be followed by the birth of placenta in or out of the water. This is also known as hydrotherapy. Definition of water birth. Water birth is a process of giving birth in a tub of warm water. Many women find that sitting or floating in water during labor helps them relax and manage the pain. Methods of water birth, pure water method and water birth emulsion method. What is pure water birth method? It is a method in which the mother enters the pool of warm water for labor after experiencing first 6 hours outside the water and then enters the water until birth. It means the labor actually takes place inside the water. Okay. Water birth immersion method is a method in which the mother is inside the pool only till the final contraction period. So when the final contraction period is over and the head is coming out and there is groaning, the mother will come out of the water and the birth will take place on the bed only. Okay, but in the pure water method, the birth is the baby comes out in the water itself. The theory behind water birth. The theory behind this type of giving birth is that the baby has been in the amniotic sac for 9 months and emerging in a water environment is gentler and less stressful for both mother and the baby. It is also believed that it reduces stress during labor and birth, which also reduces the fetal and maternal complications. History of water birth. Laboring in water is used by women for millennia. So they have been following it for many years. It is supported by Janet Blaskus. She is a writer about water births and describes the oral histories of South Pacific islanders giving birth in a shallow seawater. It is also considered as an recent development in the Western world. The first water birth that we know about in Europe was in 1803 in France, and during 1960, Igor Charkovsky undertook considerable research into the safety and possible benefits of water birth in Soviet Union. In late 1960s, Frederick Lebeyer, French obstetrician, developed the practice of immersing newly born infants in warm water to help ease the transition from the womb to the outside world. To mitigate the complications of any birth trauma. And Michael Odent, another French obstetrician, began using the warm water birth pool for pain relief for the mother. During these trials, some women refused to get out of the water to finish birthing. It led Odent to research about the benefits for the baby and the possible problems in such births. By late 1990s, interest in water birth grew in UK, Europe, and Canada. So this is about the history of water birth. Next is the stages of the labor in water birth. First stage. What happens during the first stage? During the first stage of labor, the water temperature should be comfortable for the woman, not above 37.5 degrees Celsius. The water should be checked hourly and recorded in the maternal handheld records. Maternal temperatures should be checked hourly. If the woman feels too hot, she should leave the pool until she is cooled down. Women should be encouraged to drink adequate cool fluid while inside the pool to prevent dehydration. The depth of the water should be at least up to the woman's axilla. when she is in a sitting position. This aids buoyancy and promotes movement, which aids the progress of labor and increases maternal control. This will also give enough depth and should a woman choose to give birth in the water. Second stage of labor. During the second stage of labor, the water temperature should be maintained at 37 to 37.5 degrees Celsius. This from the second stage of labor is basically from the full dilatation of the cervix till the birth of the baby. And during this time also the water temperature should be maintained. The water should be deep enough for the baby to be born completely submerged under water. During second stage, progress of emerging head should be observed with the mirror. Slow crowning and birthing of the head should be encouraged in order to minimize perineal trauma. The hands-off method of birth should be practiced. Okay, there is no meddling of hands when there is crowning and when there is mechanism of labor is being taking place. Okay, and hands off method is encouraged. This will minimize the stimulation to the emerging baby. The cord should never be clamped or cut while the baby is still under the water. The woman or midwife will reach down and support the baby as it gets emerging. The baby should be brought to the surface with the face uppermost and care is taken to ensure the cord is long enough to allow this. Following the birth, rest the baby head above the water, keeping the body in water skin to skin with the woman. This will keep the baby warm and promote skin to skin contact. Once the baby's head has comes out of the water, it must not be submerged again. Clearly document whether the baby was born under the water and the condition of the birth. Next is the third stage of labor. During this stage, if the condition of the woman and the baby allows, there is no need to clamp the cord until the placenta is delivered. Umbilical cord should be cut within 3 to 5 minutes. The mother may wish to remain in the pool for the third stage of labor and there is no evidence to contraindicate the delivery of the placenta in the water. However, the blood loss should be carefully observed. Here there is also one more difficulty is the amniotic fluid embolism. Okay, after the delivery of the placenta, there is a chance for the amniotic fluid or any fluid inside the tub to get inside the maternal bloodstream. Okay, circulation. So that's disadvantage is there, and there is no contraindicate whether the placenta should not be delivered inside the water like that. Okay, it can be delivered inside the water also. The estimated blood loss should be recorded as less than 500 ml or greater than 500 ml. Suturing should be delayed for 1 hour because the water saturation of the tissues is more here. Unless the bleeding is excessive the prompt suturing is required. Okay, so you can delay the suturing where if there is no but there is no arterial bleeding. Okay, when there is oozing, you can wait for 1 hour and then start suturing. Okay, once the tissues are out of the water and the dries out of the water, then you can start suturing. Okay, but if there is excessive bleeding, you can do the suturing immediately also. Positions of water birth: squatting, sitting, kneeling and hand knee positions. Benefits of water birth: a more relaxing birth experience, a shorter labor, no need for analgesia, feeling more present in birth experience, high rates of normal vaginal birth, possible low rates of postpartum hemorrhage. Water causes the perineum to become elastic relaxed, reducing the incidence and severity of tearing, no need for episiotomy and stitches. Immersion of water often helps lower the high blood pressure caused by anxiety. These are some of the benefits of water birth. What are the benefits of warm water? Helps to relieve labor and delivery pain, promote relaxation, boost blood supply to the uterine muscles and increase endorphin release. Warm water is beneficial because of its healing property. Benefits for the baby: it provides a similar environment as the amniotic sac, eases the stress of birth, providing reassurance and security to the baby. It is also believed that the water babies cries less, more calm and more alert. Risk of water birth, risk for the mother. What are the risk for the mother? Vaginal bleeding or placenta previa. Risk of water embolism, which is when the water inside the mother's bloodstream. Risk for the baby, infection, asphyxia, seizures. Chances of umbilical cord will get damaged or tear. And water aspiration. Contraindications. What are the contraindications of water birth? High risk pregnancy, multiple pregnancy, gestational diabetes mellitus, herpes infection, skin infection, high fever, vaginal bleeding, history of shoulder dystocia, history of cesarean section, postpartum hemorrhage, more than 1 liter. Role of the midwife in water birth. So what are the role of the midwife? The midwife will monitor the health progress of the labor, ensuring the well-being of the mother and the baby, including frequent listening to the baby's heartbeat and providing guidance. Midwife will offer guidance regarding pain relief and birthing position, assisting in the delivery of the baby and ensuring a safe birth, and provide immediate postnatal care for the mother as well as the newborn, and manage emergencies during labor and childbirth. Okay, so this is about the role of midwife in water birth. Okay, thank you. I hope you gain some knowledge regarding the water birth. We'll see in the next video. Thank you.